7:43 on this Thursday morning. Good morning and welcome back to Watch Fox News Good Day. Today we're raising awareness about the importance of a healthy smile during the American Dental Association's National Children's Dental Health Month. That's a mouthful. If you have good teeth, you'll be able to say it 10 times over. Now, we're going to also tell you about how to get a free dental screening for your little one and educational sessions for the grown-up. And here to help us with just that, Dr. Harold Jablon from Small Smiles Dental Center. Thank you so much, sir, for being here.
You're quite welcome. My pleasure.
Tell us a little about National Children's Dental Health Month. What is it about?
It's to raise the awareness of the problems that children have with their teeth, health-wise. But at Small Smiles, we don't just do it during the month of Children's Dental Health Month in February. We do it all year long. We do a community service every week. We go into different schools, faith-based organizations, and to make the children aware of proper care of their teeth, nutrition, and so it's not just a monthly, weekly thing. We do it all year long at Small Smiles to help the awareness for good dental health.
Now, you've been in practice for over 34 years, correct?
Right.
Now, during that time, you know, of course, with your practice, what are some of the common problems that children face these days, and from what you've seen as dental health is concerned?
Well, I was in private practice for 34 years before I went to work with Small Smiles 22 months ago, and I always enjoyed treating children. I always saw the underserved segment of the population. I treated Medicaid patients because I thought it was part of my obligation. But we see in the underserved, low-income families, we see a tremendous amount of decay, probably 5 times as much as in upper-income families. Access to care is a problem. Nationwide, we probably have 25% of the dental population that see Medicaid patients. In the state of South Carolina, we're a little more fortunate. It's around 50%, so it's a terribly underserved segment of the population, and basically 98% of the patients that we treat at Small Smiles are Medicaid eligible patients. So we do a wonderful service, and you know, our goal is to provide quality dental care to these patients that normally they would not be receiving.
So you're saying that one of the major problems is not just the actual care of the teeth, but the fact that the access to care is a little bit of a problem as well?
Right, absolutely.
Okay. Yeah. All right. Now, what are some things in terms of the children? What can they do to help ensure that they have a healthy smile at a young age?
Well, they improve their oral hygiene habits at home. Education is the key to that. And like I said, we do go into the schools and organizations weekly to try and educate them. Also, a big key to it is educating the parent to show them how they can help their child take better care of their teeth. We just feel like, and I personally feel like, until they're 6, 7 years of age, they don't have the dexterity to properly take care of their teeth. So if we could train the parent and educate the parent to help their little child take care of their teeth, if they would just brush them, you know, for them thoroughly once a day, we'd see a lot less dental problems, dental decay. We probably, you know, have 20 million children nationwide that are underserved, that do not have adequate health insurance.
Mm-hmm. Quickly, we're running out of time, but tell us about the free and unique opportunity that Small Smiles is offering.
This morning, we are offering free dental screenings to the children, and we appreciate you all doing the public service announcement to get the word out, and we hope we have many kids show up this morning. Once we screen them, then we make the decision, do they have adequate health insurance? Some of them probably covered under Medicaid, and we'll treat them there. If not, we can make the decision, do we want to treat them there as a service, or should we refer them to a provider out in the general public, but we plan on doing some of the treatment ourselves as a service to the community.
Well, Dr. Jablon, thanks so much for your time, sir.
Well, thank you so much. It was my pleasure.